And hello, everyone. Hello from England. This is Career Coach Rod here. I'm based in northern England, though you probably wouldn't guess it based on my accent, right? Yeah, so US expat, uh, lived and moved all over the world, and now I live in northern England and in this post COVID world. Let me tell you, I am happy not to be traveling all the time. But digital health and travel was good for me. We're having a great life up here in northern England, and now I get to talk to real people, real clinical people. Oh, hold on a second. Forgot to press one button. Now I get to talk to real clinical people all over the world, and uh, we we get to move the the expertise that people really have in real life clinical situations into digital health, where it becomes codified, it becomes part of how we're going to treat the whole next generation. I get to see people make the transformation, and it's really exciting. One of my clients, she starts her new job in digital health on Monday. Her technical background, zero. So she has nursing training. She's extremely capable and competent, and she's now going to double the salary of the average NHS nurse. Start her work in digital health, and she's made the transition. She's on the bottom rung of a ladder that goes much higher than the one that she was on. So I want to go ahead and get started for this week. On these live events, what I do is I talk about some of the new and recent events for digital health, some of the new comments, or I'm sorry, some of the new uh, developments that have happened, as well as how they relate to what I've posted this week for you to read on my, super wonderful website, and some of the content that I cover on all of the different social media channels, including Instagram, LinkedIn, etc. So drop a line in the comments if you've ever missed dinner with your family because you were stuck finishing charts. So I want to be real with you. This was my life every single day. I was, at one point I was in debt, and so I actually did work every single day, 12-hour shifts for 30 straight days in a row. Anybody out there who's clinical knows the exact nature of hell that I just described. I can tell you I haven't had any debt since then. That really cured it for me. Um, as a as a nurse, I remember writing the same vital signs on 4 different pieces of paper during one shift, and counting at my patients, I thought, wow, if I am 99% accurate, I'm making at least one error every day. Is somebody going to reference the one error and make a clinical decision on that? Well, that frustration changed my entire career path. I thought, the computers, they should be doing this for us, right? We're humans. We're not good at transcribing. We're not good at a lot of the repetitive tasks that are out there. So tonight I'm sharing something that's given healthcare workers their evenings back. And it's not just some other productivity hack or time management hack. It's actual technology that's working right now. So here's what nobody talks about. Physicians, they spend an average of 4.5 hours daily just inputting data. We've turned them into data clerks, right? And nurses, every time I worked a 12-hour shift, it was typically 13, maybe closer to 14 hours. Counting the time that I started before the shift, counting the time that I spent after the shift, making sure that I'd done all of my documentation. And that's, if you count up all the time that you spend doing your documentation, it's like more than half a shift doing data entry instead of what you were actually trained for, right? Well, so when was the last time you actually left work and you were done with it? You had no catch-ups to do. There was no weekend documentation marathons. There was no lying awake, remembering or trying to remember if there are notes you forgot to finish. Those things are causing us to lose amazing healthcare professionals, not because they don't love their patients and patient care, but because the the administrative burden is stealing their joy and impacting their life outside of work. It's really soul sucking, right? So now, what if I told you there's a technology that's achieving a documented 45% reduction in charting time? It's not today. It's not someday. It's now. It's happening right now. So this is not pie in the sky, future sci-fi stuff that might happen, when you're not looking or when you're old. This is stuff that's happening now, and it's probably going to creep into hospitals near you, perhaps the one where you work. So time to get ready and time to start planning on driving this bus so that it's done right. Cleveland Clinic just chose Ambience Healthcare after testing 5 different AI solutions. And here's what it actually does. I mean, picture it. You walk into a patient's room, you have a natural conversation, maintaining eye contact, doing your interventions, and when you're done and when the patient leaves, depending on your venue of care, your documentation is also done. There's no typing, no transcription, no errors. It's all ready for you to go, ready for you to sign off on. That's the reality. It's not experimental tech. This is actually working. It's actually in productive use. So we're talking about a $1.25 billion company with over 40 U.S. healthcare systems already using it. I said systems, not healthcare hospitals, not individual locations, 40 U.S. healthcare systems. So even Google unveiled a major healthcare AI tool this year. All of that's great, but what does it really matter? It matters because it actually affects us. It actually affects real life clinical people. Healthcare workers using ambient AI report something beautiful. They can actually attend kids' soccer games, dinners. They're not racing to finish notes and hoping that they did it right so they don't get sued later, right? Imagine leaving work when your shift ends and being confident and knowing that it's there and that it's done and it's all wrapped up. And you had almost half your day freed back up, right? It's a huge deal. Their partners have their spouses back. And because the emotional drain of endless documentation is gone, they're really back. They're like a different person. They're the way they were before the stress came. So when the work stress decreases, you can be present at home for the people you love, not just put on your happy face, put on your professional face, and try to face the day again the next day. So doctors report being more present in conversations because they're not frantically typing while patients are talking, and both job satisfaction and patient satisfaction improve dramatically. The patients can tell what's happening. Right now, the documentation it's ambient, it's passive, and it's new. I think in the future, the patients might be a little wise to it and might be more careful about what they share and how they share it. Those kinds of problems are basically job descriptions for people like us. We need to set it up so that there is absolute confidence in the system, and patients are sure that the AI that's listening to them is never going to rat them out, right? It's still doctor-patient confidentiality. It's still nurses taking care of people. It's still the care-provider relationship is enhanced rather than degraded by something listening in. And the numbers don't lie. AI-focused healthcare startups this year captured 62% of all digital health funding. So major hospital systems like Mount Sinai and Vanderbilt, they're creating dedicated AI centers. It's starting. I've spent 25 years digitizing healthcare, and I've always thought that was the groundwork. That was just the floor. That's so that we can get things off of paper and actually do stuff with them. Now we're starting to do stuff, and it's at the dawn of the AI era, so it's AI driven. So if you're in healthcare, you got a golden ticket here. Clinical experience, it can't be taught quickly. I mean, how long did it take you to become competent until you actually felt competent? I know my first year of nursing, I didn't quite feel competent, and I second guessed myself all the time. Compare that to my last year of nursing, and it's a completely different ticket. I, I feel confident in what I do, and I, and 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 my insights, that sort of thing. Um, the companies that are building these AI solutions need people with those insights who understand healthcare reality, not just the theory that they've used to set up their algorithms in the first place, because those theories lead to mistakes when they don't match real life. And we all know they don't match real life. And those mistakes cost millions of dollars. They cost maybe billions of dollars. And in a worst case, they could cost lives. So it needs our tending, our guidance. This technology isn't replacing healthcare workers. It's creating entirely new career paths. I mean, think about it. We all know that when the cars came along to replace the horses and buggies, everyone who created wheels for carts to be dragged behind horses lost their job. But it created a ton of new jobs for people who could build cars, repair cars, work on cars, that sort of thing. It's the same kind of revolution that's going on now. So don't be stuck as the person who's making the wheels when nobody else needs wheels. Right now, clinical analysts, implementation specialists, training experts, they're all leveraging your background for digital health roles. And according to Epic's post on LinkedIn, the biggest barrier to getting AI in a useful place in their hospitals with their clients is not technical. It's project management. It's talking to all of the right people. It's getting people on sides. It's making sure that the way that it's set up actually works, so that you don't have to make excuses for how the system failed here or how the system failed there. So it's the project management, it's the people side of this that is really woefully underserved, and that's what you're good at already. Some worry that AI is going to replace us, doctors, nurses, therapists, but the truth is AI has given all of us back our humanity by handling the tasks that drain our energy for actual patient care. So studies show that AI-produced documentation has higher quality scores than manual entry. I mean, have you ever been called by those people over in coding when they can't find what they're looking for, and they want you to clarify this or make sure of that? Yeah, the AI stuff, more rock solid than what you generally produce. You're not sacrificing accuracy here. You're improving it while getting your life back. So when you're not emotionally exhausted by paperwork, everything improves. Patient relationships, family connections, even sleep quality. And I use a sleep monitoring app because of all of my travel days, and I can actually score how well my sleep changes when I don't have all of that sort of stuff hanging over me. It is a marked difference. So if you're drowning in documentation, research ambient AI options at your facility. Research ambient AI options for perhaps your next job. Be the voice advocating for solutions for both clinical people and patient experience. Be the voice training these things so that they actually work in real life, and they can go beyond just documenting a simple visit. Most of the large language models right now, the LLMs, are multimodal, right? All I've been talking about is ambient technology that listens and then provides documentation. Well, multimodal can see too. So what if it can see and it includes visual documentation of what you actually saw as well? I mean, that's what's coming next. That's the opportunity that's there for you to grow and build a digital health career on. So if you're considering a career in digital health, ambient AI companies, maybe that's the right way for you. They need clinical professionals who understand workflow realities. Your healthcare background is exactly what these companies value most. So drop me a freedom in the comments if tonight's message has resonated with you, and DM me if you want to discuss how your clinical experience can translate into digital health opportunities. So if you've got something you want to DM me and you're afraid that perhaps it's impolitic or you wouldn't like other people to see it, and that's the chat that's available on tonight's live. but perhaps you want to DM me privately. So you can do that on multiple platforms, whichever platform you happen to be watching on now. Just remember, all of our families are waiting. They're waiting for us to get this right. They're waiting for us to get that 45% drop in the amount of time that it takes to actually do the documentation. The 45% solution is here, and you can be ready to reclaim the joy of healthcare, help others reclaim the joy of healthcare, and get everyone's personal life back. That's my message for you this week, and I hope it's been insightful. I hope it's been inspiring. And if you want me to cover something different next week, just let me know. I'm very happy to take on any big areas that you might have questions on, and sort of pull back all of the curtains away from digital health. Tell you exactly what you're looking for. Address the real doubts that you have. It can be scary because it's computers, and we weren't trained necessarily on computers. But it's really just another tool, right? You didn't have to, like, back in, say, 1998, 99, you didn't have to become a coder. You didn't have to become a coder in order to work in electronic health records, electronic patient records. Same thing's happening now. You don't have to become a coder to work with AI in digital health for the improvement of healthcare. The thing that's a common thread between all of them is your clinical experience. We can help you with the rest. We can help you through the technical part. You can do it yourself. Whatever you do, we need you. There's not enough clinical people in digital health, and we need you. So please get on the bus and get behind the driver's wheel, or work with somebody like me so I can tell you how to do it. Thanks, everyone. It's about dinner time here in England, and good night.